Hello everybody. My name is Michael Freeston. I am Director of Quality Improvement at the Early Years Alliance, and it's my pleasure to welcome you today to the next in our series of Welcome Back webinars. This one particularly focusing on supporting children with additional needs back into early years provision. I am delighted to be joined today by Nikki Gibson, our Inclusion Manager.
Good evening.
And Melanie Pilcher, Quality and Standards Manager.
Good evening, everybody.
For those of you who've been on this journey with us on several of the Welcome Back sessions, we'll follow a similar format today in terms of we have a series of slides, a presentation to be shared by Nikki and Melanie, just updating on general guidance that has come from DFE, but also looking with particular emphasis on children with special educational needs and disabilities. But this is very much your session. If there are questions or comments that you wish to make, what we like to do is to weave them into the presentation as we go. So don't feel as though you have to wait for the end for a question and answer session. Do feel if there's any comments or questions, or if you want to correct us on some things, because things change all the time and local circumstances might be different from what we're talking about, do feel that you're able to contribute those as we go along. Clearly, with the particular subject matter we're talking about here, we can't address any particular issues that you may be facing with an individual child. We're talking in terms of general principles here and policy requirements. But obviously, if you're a member of the Early Years Alliance, then we can pick up with you offline and with email information and have those conversations more specifically. And also we are now offering consultation services as well on these issues of special educational needs and disabilities, and also various others, and those information about that can be found on our website. Right, let's see if I can work the screen now. So that you've got the faces to the names, Nikki and Melanie, who just introduced themselves, and that is me. The aims of today's session. This particular session, just coming before term ends, came about because we received a huge number of requests for a session which focused specifically on the impact of COVID-19 on children with special educational needs and disabilities. So we are responding to considerable demand in that area. We also want to look at supporting the transition of children with SEND back into settings. We'll reflect on the progress of SEND reviews. And we would, as I say, invite you to share your experiences in supporting children with SEND during the pandemic. You may well have remained open for key workers and vulnerable children, and you may well be able to share your experiences with us, and we would hugely welcome that, and I'm sure your colleagues who are participants on the webinar will do so also. So, without further ado, just taking a few minutes, I'll invite Melanie to give us an update on guidance, because even since we did the last session 2 or 3 weeks ago, there has been considerable more guidance from the DFE, and it just seemed a sensible opportunity to update colleagues as best we can. Melanie.
Thank you, Michael. In fact, since we woke up this morning, there's been additional guidance and changes to the guidance. So, and it just struck me actually that we're now on version 10 of the actions for early years and childcare providers during coronavirus. So what we've tried to do throughout all of these sessions is to try and distill some of that information for you. And if Michael, if you can just click on through the slide, just so that we get it all up, thank you. You will see we put the link in there to the most recent guidance, and that was issued as of today. So just to go through what some of the changes are. What they've done is, as you know, they issued a planning guide for early years settings to support you in going back. And that planning guide's now been removed from their website, but some elements of it have now been incorporated into this one document with the aim of trying to put more information in one place, because that has been a real issue for everybody. I'm shuffling paper around on my desk now, and you know, and I'm not doing what you're doing every day, trying to manage the situation. So it has been a challenge. The next thing that they've changed or added is the autumn funding update, and there's a hyperlink to your local authority information there about how the funding will work from autumn. So that's again a really relevant and important one for you. And if we move on to the next slide.
Oh no, information about wraparound care. There was another one.
Oh, right, you hid one there.
Sorry.
Yes, they've clarified that there's been lots of information about wraparound care that's been flying around, and they've now clarified that and put it into the main guidance document. So nothing terribly new in there from what we heard at the last update, but again, it's all in the one place. And then on the next slide, you'll see we now have more information about managing site visits for September admissions. So this is really about how you manage the idea of parents and children, new starters, visiting your setting from September. So again, it refers to things that have been going on, such as virtual visits, and just really what you should be doing and how you can manage that situation. They've updated the information about data collection changes. So again, you need to be aware of that, and also about reporting to Ofsted re a confirmed case of coronavirus. So very much what we've been saying all along, it's a notifiable disease. If you have a confirmed case, you must report it to Ofsted as you would do with any other confirmed case of a notifiable disease. They also reiterate that you must report to Ofsted if your setting is closing. They've updated information about keeping children in small groups, but still minimising mixing where possible. We knew that was happening from the 1st of July. And just to also mention that with regard to some of the public health information that they've incorporated into the guidance around infection control and PPE in particular, they've actually put in and clarified where some things are a must and some things are should. So just as we have in the EYFS anyway, very clearly what you must do, and some things which are should, as in, you need to manage the situation and do what's best for your setting. So the guidance is under constant review, and we will keep you posted as and when. And as on that note, I'm going to hand you over now to Nikki.
Thank you, Mel. Good evening, everyone. I was going to go through the part 3 of the Children and Families Act of 2014, but I think you're all pretty familiar with that. But really, it was just aimed at improving and streamlining SEND provisions. So 2014, we thought it was all sorted and we could move forward. However, it's been a bit patchy, to say the least, and there's other associated issues such as funding for SEND, which won't be a surprise for anyone. It's caused some considerable concern, especially in our sector. So over a 3-year period, there have been a number of actions to try to resolve the issue. So the first being in April 27, when changes to early years SEND funding were introduced with the DAF and the SEN Inclusion Fund. However, despite that, concerns still remained, especially around the Inclusion Fund. Now, I know this is it is again patchy. Some areas are doing it really well, so it'd be interesting for you to feedback at the end of the session. In 2018, the Education Select Committee conducted a SEN review. Now, their interim report was highly critical of the SEN framework. And then in 2019, they conducted a funding inquiry. Those results are yet to be published, so we're pending hearing about that. And in February, the Alliance conducted its own SEN survey, and I should think many of you probably contributed to that. Now that's a report's going to follow on that. And there's other investigations highlighting concerns. Ofsted and QCC highlighted failings in local area inspections, the National Audit Office, Local Government Association, and also the Public Accounts Committee. And now these scrutinise public expenditure. So they've all identified concerns. And in May this year, the Public Accounts Committee stated the results of the SEN review must now be published. So it's getting pretty serious. There are some serious concerns, and we need to know the next steps forward. On the 12th of July, government did actually give the go-ahead to Ofsted and QCC to support and strengthen the SEND system. So that's a positive. Those last two aren't positive. So we're still waiting the overall findings and recommendations of the SEN review, and during this time, early years settings have dealt with rising numbers of referrals and pressure to support children with reduced local funding, ineffective systems, services shutting down, and like I say, with increasing numbers of children. But hopefully, changes lie ahead. And well, we'll have to see. But at the moment, that was the situation before COVID. Next slide, please, Michael.
Thank you. Oh,
So then we had COVID, unfortunately.
you make it sound like it's gone, Nikki.
Well, yeah. So it's been a challenge for all of us, but it's especially been a challenge for parents because they've become their children's teachers, their buddies, as well as carrying out normal activities and working, many working as well. But for some parents to children with SEND, it's been especially hard because not only have they become teachers and buddies, they've also become therapists and 24/7. I want to just quickly share a survey carried out by the Disabled Children's Partnership, which gives them insight into the lockdown life for families with disabled children. So the Left in Lockdown survey received a staggering 4,000 responses from parents of disabled children and young people, and that won't surprise most of you. And the top concerns were the impact of the lockdown on children's behaviour and mental health, the impact on children's friendships and managing homeschooling. So 78% of the parents in the survey reported a decline in the mental health of their children, with 64% saying the lockdown had a negative impact on the child's disability or condition, and 51% of those that were receiving therapies and extra support said it just stopped. So it's hard to just justify what's just gone on. It's really hard to get your head round. Sorry, Michael, were you wanting to ask something?
No. I was going to say, it's an error of mine that I haven't got the link to that report. Where is it published, Nikki? Can you, or we can change?
I will give I give a link at the end. So I just repeat, it's a Disabled Children's Partnership, and it's called the Left in Lockdown.
Thank you.
So I'll just give you some tangible evidence of some of the cases we've heard about. So one parent with a child newly diagnosed with cystic fibrosis had no option but to carry out daily physio on their child during lockdown. Now, this isn't unusual for parents when the children get older, but right at the beginning, they only just had diagnosis, and the parent felt so stressed and unsure that they were doing the right thing and keeping the child safe and necessary, sometimes life-saving. So I think we just have to be thankful that there was a really good online support from that service, that physio. Another parent with a child with a social communication difficulty reported that their child was literally climbing the walls and screaming because his routine had been disrupted and he was unable to go outside. So these families, are really facing some extreme levels of stress and anxiety, and it's not gone away. And added to that, short breaks also stopped. I think they're starting up. Some areas may not have stopped at all, but generally they stopped as well. So actually there was no respite for the parents or for the children. So the transition back will not be easy for all children. We know that it's impacted on a wide range of families. So some families with children with mild SEN chose not to return to their settings in June. And even families that had children that were classed as vulnerable continue to isolate even when the condition was offered early on in lockdown. So this is, I would say, a combination of fear, misinformation and confusion. And it's not surprising, it was confusing and scary for all of us. But we just want to ensure that doesn't happen in September. Because this lack of intervention and support will really have already impacted negatively on some children's development and risks impacting on their ability to socialise and future inclusion back into education. It would also have impacted on the well-being of some parents, and we know that for sure, that it has impacted on the mental health as well. Unfortunately, this situation has further been compounded by a suspension of parts of law and policy. Can we have the next slide, Michael? That gives us a bit more information. So early on in the crisis, government suspended specific elements of the law, which meant some children had to go without some crucial services. So this included suspension of Section 42 of Part 3 of the Children Families Act. So it wasn't all of the Children Families Act, it was a particular section. And this focused on time frames around statutory assessment, educational healthcare plans, reviews and tribunals. And it also the duty to deliver on the EHCP provision. So that meant.
Sorry, Nikki, I was going to ask, the detail of that, was the motivation on the basis the fact that it was actually impossible to do assessments?
I think so, but I think it was also, the services wouldn't be able to deliver it. But it ends at the 31st of July. So
did I not see there is something, a consultation to see whether it should be extended? And I might be incorrect on that, but it was just something I saw last few days.
Because as far as the suspension ends the 31st of July, but it could resume again. I think with that particular one, it meant that external services only had to make reasonable endeavours to secure provision for children. And there were certainly some challenges to the legality of it from a human rights perspective, but you can understand that some areas probably carried on providing that service, Michael, but I'm just not sure. We haven't got a big enough picture. Mel?
Michael, if I can step in here, because I've got the guidance in front of me here that talks about this, and they say that they are hoping they won't have to extend the EHC needs assessments plans and so on, but obviously they're going to keep on reviewing the situation.
Thank you.
It would be awful if it did happen, because I think there's some very good local good services, but
have we lost Nick?
Have you still got me?
Yes, Nikki.
I
think
we lost you for a second there, Nikki, but I think you're back now.
Right, this application modification applying to EYFS and set as expected use best endeavours. I'm going to pass over to Mel for this one and the one around inspections, because she's our expert on that. So Mel, could you just clarify what's happening with these?
Yeah, absolutely. The disapplication and modifications that we're all very aware of, specifically around the paediatric first aid requirements, about the learning and development requirements, those will remain in force until at least the 25th of September, but they are being reviewed all the time. So again, in the updated guidance, they just give us a little more prompting about how we should try to implement the learning and development requirements, use our best endeavours to do so. But all other aspects of the EYFS do remain in force, and should Ofsted receive any concerns that a setting is not carrying out their requirements under the EYFS, then they will actually investigate. They will still investigate, because they still have that duty to regulate and monitor.
Do we know if that's happened or no?
I haven't heard of it happening. I haven't heard of them having to do that. I don't know, Michael, if you've heard anything.
No, I haven't picked anything up.
No.
And I think there is also a recognition on the part of Ofsted, although this hasn't been formally noted, that once we move back into something which can be considered to be normality, we won't necessarily go straight back into general inspections. There does need to be a period of transition from that point of view.
Absolutely, but what Ofsted have said is that from September they will be doing some support type visits. So particularly in settings that were previously graded as inadequate or requires improvement, they may well do some visits to those settings, but they won't be issuing a full report on those settings.
Yes, I think that's more in terms of
supportive measure than anything else.
And also checking that the progress has been made to the requirements that have been outlined at the last inspection.
Absolutely, and they intend to reintroduce inspection schedule from January. So we will be back to normal service, hopefully. But I think that all other statutory duties still apply. So
yeah, that's right. I think that's the worry, is that people think, oh well, we don't have to meet the other statutory duties, but the Children and Family Act still applies, as does the Equality Act. Okay, so so the limits to nursery sizes. So do we have bubbles ended now, Mel?
Yes, they have.
They burst this week on the 20th of July then.
Yeah, but we should still be looking to minimise the sort of mixing of those groups as much as possible, so to minimise contact. And actually what we've heard anecdotally is a lot of settings have actually kept their groups, their cohorts, their bubbles in place, and will continue to do so while numbers remain small, because actually it's working for them. And that actually is a benefit, isn't it?
Yeah, there doesn't seem any point rocking the boat, does there?
Absolutely.
Also, today, government stated that all children with SEND should return to settings in September, and they strongly emphasised the benefits of getting children with SEND back into education, which they said outweighs any risk. And just wanted to talk about, because during the pandemic, as I'm talking as if it's over, we did hear of some children being unfairly excluded from education settings, or not even excluded. They weren't invited back. I think that was usually out of fear rather than discrimination or confusion again, because I don't think any practitioner, any teacher wants to purposely exclude anyone. But now we've got to move forward and plan for all children to return by September. So that means carrying out risk assessments on children with SEND, if you're not already doing them. So risk assessments with children with SEND should really always be co-produced with the family. And the assessment should never be used as a checklist to exclude children. And I think this sometimes happens. And I'm not saying about settings, I'm talking about education generally.
Right. Yeah.
At the start of the assessment. Yeah, sorry, Mel.
I was just going to say, we had a conversation earlier, didn't we, about the emphasis really should be on the risk benefit of actually getting those children back into settings, rather than, as you say, using risk assessment to inadvertently exclude them. Yes, yeah.
So it'd be interesting to, yes, and we're certainly going to look into that more, because I think it's more valid than ever to have risk benefit approach, isn't it, Mel? So so you need a clear discussion between home and the setting as to how to keep the child safe, overcome barriers, and achieve benefits for the child. So it's not what suits us, it's what suits the child and family. Come September, before September, so if you haven't already started, I'd advise settings to take 2 steps now before the end of September with their children with SEN and SEND. So after speaking with parents, review all SEN support plans. Now this is a recommendation. I would say this is good practice, and Mel will probably want to add something on the end. So all of those with SEN support plans and those with EHCPs, because of course they may not actually be having any other services come in, and where necessary make referrals. Number 2, review these children again towards the middle or the end of September. So do even if you're used to doing a 3 monthly review, I would review them again once you go back, because these children had considerable changes, and I think it's inevitable that they're going to need resettling in, redeveloping attachments with their key person. They may have regressed in other areas. They might have even advanced in a lot of areas. Some lockdown really suited some children. There may be some new behaviours and needs which need to be properly identified and addressed. So, and there will also be those children that you're picking up as with emerging needs and require assessment. Don't forget, the best endeavours around developmental checks. So you will be still picking up on those children. So.
Sorry, if I can just,
don't delay. Yeah.
if I can just interrupt, I had a question in from
Yes,
Alison, and
Michael.
it's just reflecting back on where you were talking about,
Yeah.
and I think we've got a problem with somebody's microphone. It's picking up some. Can we sit still? I think, where it's about reviewing and updating, they were having conversations in February for a child with special educational needs to join the nursery, and in a period that actually at
Yeah.
Easter, but obviously that has not been possible. So it's almost, what advice can we give for people who are looking to welcome a new child with special educational needs in September?
Yeah, I think it'd be exactly the same as what we're saying now. You'd be settling the child in, wouldn't you? You'd be looking at forming attachments. So actually, if they haven't started, in some ways, it's no different than what we would normally be doing. I think it's the children that have come in and gone back and been away for a few months is often an issue. Does that explain it, Alison? That's certainly the perspective I would take.
That's right, and I think she's had indicated it's not the first child with SEND they've taken. So I think it would, as you say, it's a process is as usual would be sensible. But obviously there may be additional anxieties on the parts of the parents because of the period of time we've just been through.
Yeah, I think some parents are going to feel reluctant to allow their children to come, even if they were meant to start. Some are going to be reluctant to let the children come back. We've got to build confidence in those relationships with parents again. It's not just children, it's parents as well.
And that's the big challenge, isn't it, Nikki? Because whilst we're welcoming back the children, what we have to remember is the biggest risk that's still there is actually the contact between the staff and the parents, which we're still limiting, really. So thinking about ways of being able to have contact with the parents, not you can't have the parents into the nursery still. So the idea of having these virtual visits and these definitely use WhatsApp or Zoom.
We're having a bit of trouble with the sound. I think we're going to have to be careful not to speak over each other. Sorry.
I think
and restart. There we go, Nikki. Yeah.
I think as long as you establish regular contact from the off, even if it's via video link, a lot of parents won't have video links. So, maybe it's something you could look into getting some handsets for the setting. And I'm sure there's ways of achieving that, Michael, isn't there? So if that's something, if you've got parents that are isolated and they haven't got that type of ICT, then do contact us and we'll see if we can find a link. So there's going to be those parents that aren't going to come back, and we're going to have to work closely with them and liaise with all the relevant external services, because at what point does it become a particular issue? Anyway, we've got some additional resources we can share afterwards as well. So PPE. So you probably heard that the advice. I don't know what you've seen earlier on, Mel, in the advice, but generally the advice is that we don't need to use it.
No, not over and above what you already use anyway.
Yeah. I would suggest that, you need to, when you're doing your risk assessment, you need to find out which children would benefit from it, because although the government suggests using PPE when working closely with children with complex needs, the aim is to protect the staff from getting infected. But we know that children, although they're not affected the same way children from COVID, if you have a child with complex health needs and any other perhaps a compromised immune system, I would suggest you consider getting PPE to use with these children during times of close contact to protect the child from staff that perhaps may be asymptomatic, because there's too little solid research facts about the impact of COVID yet to say there isn't a risk. And I would much prefer us for settings to use PPE when they have a child with complex needs, because we know that some children are developing associated health conditions, but the research is not conclusive on that either. So why risk it when you can actually get PPE? So earlier settings can access PPE from their local authority.
I'd be interested just to interject on that one. I'd be interested in people's experience of accessing PPE, medical grade PPE from local sources, just to see how that has been, because I think you're absolutely right. The statement is you should be able to get it, and there is the link. Whether that has transpired in reality, I would be grateful if people would comment.
Does anyone want to put their hand up and say if they've done this and got through to your local resilience forum?
That may come through in due course, and I'll see where we come through.
We have heard anecdotally, Michael, that some settings have had trouble actually getting the LRFs to supply them, whether that's because of a shortage of supply or whether they don't feel that early years needs it. So I think you need to be quite adamant if you're asking for it.
Yeah.
So leaning in is the phrase, isn't it? Being quite assertive.
That's right. I did actually do my own inquiry before I'd done another session, and I went through to the emergency PPE line, and they did put me in contact with the local resilient forums, and they did say that if you really can't get anything from local authority, then you can go through the emergency system. So I've got the number there for the emergency, but in the first instance, you contact your local authority, Google local resilient forums and contact. But this is for children with complex needs. I just don't think it's worth the risk. You know, if you have any difficulty, contact us. Michael, I think we could.
I think we would be compiling. We don't have a stock ourselves, just for clarification, but I think we do compile information on behalf of the sector, and it presses our case when we're saying that things aren't working as well as they should be. Just on that, and I've had a question in that links back to the previous question from Alison, and this one's from Amanda, who does have a new child starting in September. The parents want specialist provision, and the question is, how can I support this given the short time frame between starting preschool and SEND school panel, which is happening in October? I think, Nikki, I think we might be back to the dialogue.
I was going to say, do you know, if you know anyone on the schools forum, perhaps your early years representative, I would contact them, because they haven't been spending any money, have they, the last few months? So I'd get in contact with the early years representative.
So yes, I think there is a short window when Amanda and her team will be supporting this child, and I think again, probably what we're talking about here is the ongoing dialogue with the parents about what is realistic and indeed what is possible in that period of time, and the liaison with external agencies as well will be essential. But I appreciate that it's a considerable amount of input on your part for a child who will be with you for presumably a limited period of time.
It depends how complex the needs are and how short we're talking about the time frame. If we're talking about 6 months and you're having to collect evidence to submit, yes, it might be too short. Is it as short as that?
She may come back. I will feed that back in as we go through. And she's also indicated they have one set of PPE.
Oh, wow. We're impressed. Perhaps you could share how you actually got hold of it. Okay, so just a quick run through. So you still have a lawful obligation to meet statutory duties. You must supply reasonable adjustments to not treat disabled children less favourably. You need to use best endeavours to meet EYFS requirements. Inform the local authority if a child is identified as requiring additional support beyond what you can provide. You should work in partnership with your local SEN team. Include where available area Senkos, sort, you know, whoever. I did a last webinar done a couple of weeks ago. We were hearing that local teams were making contacts with settings. So I'd be interested to hear about that. And collect your robust evidence to support your funding applications. Don't give anyone the chance to turn you down. And if you want support, contact us. We're here. If it's not me, it'd be Mel or one Michael's team, and where we can, we'll find out, and if we don't know, we will find out from someone else. So
I've just had a couple of points in, and I think I'll take it as from Fran, but 2 or 3 people have asked the same question. That potential confusion in a way between still having the lawful obligation to meet statutory duties, but then the disapplications for the EYFS which are in place. Are we how does that impact on children with
Well,
special educational needs and
I
disability?
think the best endeavours is the best way to approach it, and
Right.
I know settings are still doing this. You know, really, there wouldn't be many incidents that you wouldn't be able to. But you're quite right. It is more challenging if you've got a really busy setting and lots of children with SEND. Come September, you'll be expected to do it anyway. So I think we need to look to the future and not what the current system is. If you really, yeah, sorry, Mel, please. Yeah.
I'd just add to that to clarify that the legislation for the disapplications and modifications was allowed really because of the lack of staff that was expected during, during lockdown. So really, anybody that's getting back to normal now should really be working towards meeting their full obligations under the EYFS, because if you're not and something goes wrong, you will have to justify to Ofsted if they do ask the question of why you were doing that or weren't doing what you were supposed to be doing, especially if you're back up to speed and have got your full staff complement.
Right, thank you. Thank you. I hope that's okay for you, Fran.
Yes, so for me, that's, yeah.
Melanie, do you want to walk us through that?
Yes, I normally talk through the last slide, which gives Michael a chance to scroll through to see what questions have come in. So really, this is just about saying, please remember the resources that we've got in place to support you. So I just wanted to do a quick plug for those resources again. We have our most recent Welcome Back pack is for the Welcome Back Family Services, as we see baby and toddler groups and other unregistered services, family services, starting to come back again. So that's available through our shop now. We've got our online Connect events and virtual classrooms, which are happening across the country. And the email link is up there. If you email, you can find out what's happening in your local area. The members area on our Alliance website is updated daily, and as I mentioned earlier, things change so rapidly, and we've got an excellent team who are really on top of this and making sure that we update all our FAQs with the most recent government guidance. So do have a look at the website to see what's on there. That's one place where you can get all the information, one-stop shop there. And also just to mention as well that we will be offering consultancy as well. And again, if you look at our Alliance shop, you will see how our consultancy offer works. Predominantly Nikki and myself, I think, in the first instance, who can offer that consultancy in our areas of expertise. So find out what we can offer.
Thank you. I'm grateful to Amanda. She's given us a bit more information, and I think her specific circumstance highlights a lot of what Nikki has been explaining. For this particular child, we have diagnoses and some reports back from health. The child is due to stay with us until next July, but they will need to apply for a school place for September 21. So I think what that identifies, that particular circumstance, is that how everything has been compressed. In many ways, it's business as usual, and it's supporting the needs of children with SEND as best you can. But the timeframes have been compressed, and so that need for effective liaison with external agencies as well as the parents is as soon as really does highlight the challenges that practitioners will face.
But can I also add that you really do need to, settings need to know who their early years representative or their schools forums are, because, you know, often you can actually channel some information through to these forums. Sometimes there's no early years representative, which doesn't make for good applications, because these are people that agree all the funding. So I would recommend you do that as well, and contact all the various agencies, perhaps get them to meet up virtually. You need to sort things as early as possible. There's going to be delays on everything, unfortunately.
Yes, so as it sounds harsh during the summer holidays, but as soon as possible is clearly the advice we're giving. I do have to reply to Nicola, who is so profusely apologising for joining late. You will still get the slides. Anybody who registers for the event gets the slides. They'll be sent out hopefully tomorrow. And she's very kindly reminded me to say that it will be available on the YouTube site, and she promises to watch it. There is no penalty for being late, Nicola.
Thank you, Nicola.
Thank
For
you.
my name's sake, I'm sure she will.
And I'll pick up with Rachel the question you've asked offline, because that's more of a technical one. I'll do that in the session. So for those of you who's been with us before, this is my waffling bit, just to see if anybody is typing with any subsequent questions. But we don't artificially extend the length of the webinar. So it remains for me to say thank you very much to Melanie and Nicola for leading us through the updated guidance. And I think from my perspective, what it leads to is the summary of, as with much around the guidance now with dealing with COVID, it's over to our professionalism and our engagement to do what we do well. There is no longer the sanction, that things aren't compulsory. It is recognizing that actually we know what we're doing, and the recognition of the professionalism that you can bring to it. Just a general question again that's come in. Do anyone know where a child had an appointment with the CDC which had to be cancelled and used a telephone conversation? Would settings still receive a report? That's a technical one, Nikki. Do you?
Sorry, so yeah, I worked in a CDC, so it was so you had an appointment, but it was cancelled, so nothing happened. Is that right?
Yes, it was a telephone conversation. So I'm assuming that still counts as a formal meeting, and there will be a report.
Oh, right, yes. Well, yeah, I would just follow up with the CDC, find out what's happening. You know, these are very approachable places. Yeah, I think just things are getting put on the back burner and people are forgetting. It's a different way of working for everyone. So I think we won't be critical. We'll just say contact them again, find out what's happening. Ask if you can have the report written up. There's no reason why a verbal can't be turned into a hard copy, because that's what we want in our files, or electronic copy.
The evidence does still need to be there. Okay, thank you very much. It's nearly 7:15, or I think we'll take it on from there. Nothing seems to be coming in. It doesn't tell me that anybody is typing. It just remains for me to say thank you to all the participants for giving up. If they finished at the end of term last Friday, well done, or it may be that tomorrow is your last day, or today indeed. And we will wish you the best of summers, and we will see you with future webinars as we come back in September. Thank you, Melanie. Thank you, Nicola. Please say goodbye.
Thank you.
Good night, everybody.
Good night.
Good night, everybody. Take care. Bye-bye.